New tonight, calls to a mental health hotline in Tulsa might go unanswered if lawmakers fail to pass a budget.
2 Works for You reporter Tony Russell shows us how a state funding cut is going to affect a group of professionals that deal with people in a mental health crisis.
When someone needs help in Tulsa, they call 911. But if someone is going through depression or having a mental health crisis, they call a special confidential hotline. Community Outreach Psychiatric Emergency Services, known in Tulsa as COPES, answers those calls 24/7, roughly 1,300 a week. Family and Children's Services, which runs the COPES program, is facing a $15 million cut from the state. I'm told when that money dries out, 19 jobs are gone. And those hotline calls, people are going to have to call 911 instead.
When you think about the families of those individuals within this community that may end up losing their lives if they don't get connected to mental health services.
Amanda Bradley says COPES' mental health professionals work to keep those in crisis out of the hospital ER rooms. Bradley says without their hotline services, someone going through a traumatic episode could easily end up in jail instead of getting the care they need.
What could happen if they're overly agitated or angry? They may be arrested for something, and then just the trickle-down effect of that.
Family and Children's Services says that multi-million-dollar cut not only ends the crisis team, but ends outpatient therapy and case management programs.
It's absolutely hard to even prepare for something of that magnitude.
Administrators say an end to those programs could affect Tulsans' lives.
If we do not respond now, they must take action. Indecisive non-action is an action.
Coming up at 6, we'll look at the crisis response team. That's a group of police, fire, and mental health professionals from COPES. We'll tell you how budget cuts could affect a program that hasn't even launched yet. In Tulsa, Tony Russell, 2 Works for You.
And more than 700,000 Oklahomans suffer from some form of mental illness. Oklahoma, by the way, is ranked as one of the worst states in the nation for overall mental health. This is according to the Federal Substance Abuse and Mental Health Services Administration. More than 70% of adult Oklahomans with mental illnesses receive no treatment, mostly due to a lack of access to help.